When your child has a runny nose, cough, and fever, how do you know when to take your child into your primary care provider? Respiratory symptoms usually include a runny nose, cough, and fever. Those symptoms are very general, and you can feel pretty lousy at the beginning of a cold. Between day 1 and 5 of an illness, you'll usually know how severe that virus is going to be. Those first 5 days, you're going to see other symptoms, like a barking still cough. You're going to see some funny breathing. Your child might be breathing like that, and that's not normal. You may have a child who their color is off and they look pale or blue in their lips, and that wouldn't be normal either. But most of the time, whatever virus started the illness leaves you with a lot of other symptoms that make you feel lousy. So, what I like to recommend, if your child isn't breathing funny, if your child doesn't look pale, then maybe treat some of their symptoms and see if you can help them feel better. And as the fever comes down, if they perk up, that's a good sign. So what if they get to day 5 and things kind of peak, and day 6 is about as good as day 5 or a little better, but now there's new symptoms, day 7, 8, 9, 10. Now there's new fever. That fever that lasted a couple of days, now it's like back with a vengeance. And now your child is complaining of ear pain. And well, now you know they need to be evaluated for an ear infection. Fast forward a few more days, we're now 2+ weeks from the beginning of this new illness, and now there's face pain and a gagging cough that makes them throw up, and when they throw up there's green mucus, and that would suggest that they've now developed a sinus infection. So rushing in too soon may expose your child to other potential illnesses. It may expose your child to unnecessary antibiotics. 80% of ear infections do get better on their own. Whenever we prescribe an antibiotic for an ear infection and they get better, would they have gotten better without the antibiotic? One could argue. So how do you know if your child is in or having respiratory distress? Well, the first thing is they will have increased respiratory rate. Now let's look at this under 1 and 1 to 5 and older than 5. So under 1, if they're breathing faster than 60 times a minute, that's considered fast. Between 1 and 5, if they're breathing faster than 40 times a minute, that's considered fast. Other things that you would look for to know if they're in distress would be retractions in the chest, nasal flaring, a head bob breathing, grunting, wheezing, stridor, elevated heart rate, color change, sweating, and changes in their level of consciousness. Now, when you feel lousy early on in an illness, you may breathe a little faster than normal. So as the fever comes down, does the rate come down as well? And it should, unless they have something more serious. How do you know if your child has low oxygen? Your child may act very tired and may have an altered level of consciousness. Sometimes if they're lying down, they will lift their chin up to get themselves into what's called a sniff position, and that helps them breathe easier. When you have maybe pneumonia and need oxygen, you're going to need all the help you can get to get air in and out to help you exist. Sometimes when children are struggling with breathing, they will lean forward and kind of tripod onto their knees, and they'll extend their neck and they'll really struggle that way. Those are just a few things that can help you know if your child is needing to be seen more urgently. Now, all along the way from day 1 to day 14 plus, pneumonia is not a fun diagnosis, and that can be made at any point. Early on, that would be more likely a viral pneumonia. There are a few cases where children may just start with pneumonia from an organism where your child would need to have antibiotics to treat them. But hopefully this is helpful. Hopefully it'll help you access your primary care provider in a timely manner and help you avoid any undue expenses. Thank you.